Well, good morning, everybody. Jeff Slakey here on the Daybreak Show. And on the phone line for our Sheriff Sit Down, we have Mason County Sheriff Casey Salisbury, also Dave Windom. Good morning, guys. How you doing?
Good morning, Jeff.
Morning, Jeff.
Yeah, good to talk with you. Last week, we heard the governor put forth phased orders to kind of reopen the government. This has been a little bit of a tricky subject for some folks out there, and we're trying to kind of just better understand where Mason County is with all this. And Dave, talk to me a little bit about the different phases and how we think we can get Mason County through.
Okay, so right now, as of the governor's conversation last week, we're basically sitting in phase one. And pretty much everyone is sitting in phase one. Now, he did talk about some counties, 10 counties, that are able to go to phase two. And phase two has more openings to it. It has... I'm sure everybody saw the graph that the governor used that showed things that open up. Phase one has some significant openings, but we really, a lot of us are looking at phase two and what does that mean and how can we get there?
Okay. And
I've been working on that this weekend. So the process of that is what's called a waiver. So spent a good part of the weekend working on a waiver that would address all those data points that we need to meet in order to move forward and still keep us in that realm where we're safe and we won't see a resurgence of the virus as we move forward too.
One of the things that, and stop me if I'm wrong about this, but since you guys worked so rapidly on making your proclamations, your declarations, working hard on understanding these numbers early on in the process, that would lead me to believe that you've got a lot more data showing the trend lines that you could send to the governor versus other counties that may not have picked up as quickly on this information or have been as close to some of the main contact points.
Right. So really, if you look at our data and you look at our epidemiological curve, the epi curve, we peaked really back the last week of March. So, and of all the testing that we've received that was positive in April, those were tracked back to people who were sick in March. So really, we've had a pretty good month with April. So we're looking at that and then doing an analysis on that. And if you look at what the CDC is talking about in cases per 100,000, and we look at that in cases per 64,000 for Mason County, we're really underneath what the CDC would like to see us be at in order to move forward. So we're trending in a good way, and we're going to present that data, from the DOH website. So we take that as a place of agreement between ourselves and the governor's office. We can all agree on DOH data. All right, then let's use that data and have that discussion.
And so moving forward, as I read, each phase is kind of a few weeks process before things get looked at. If we are in phase one now, and the data that you put together over the weekend looks promising for Mason County, how quickly do you feel that you would be given that waiver variance to move more quickly into phase two as opposed to the surrounding counties?
Well, that's a good question, because that was one thing that we found that was pretty vague as we read through it this weekend, to say, if there's 3 weeks in between each phase, but when does that start really?
Yeah.
So what we're working on the premise of is once we get this through a process, and there is a process. So I've written the waiver. We'll go through it today, see if there are any gaps, truth it against what our hospital and medical staff have to say. And then it has to go through the Board of Health and the Board of County Commissioners. So that's going to take a little bit of a process. So we would like to see it go to the governor's office either late this week or early next week for consideration as soon as possible. And that would start us into phase two. And then we would have like a 3-week, hoping a 3-week phase in phase two to get an idea of how things go after we start to release some things.
Casey, we talked last week casually about how things have been going through the county, and for the most part, I would say that the majority of folks in Mason County, those 64,000 people in Mason County, have been adhering to these stay home, stay healthy orders by the governor. But as the weather has gotten nicer and as we have seen the numbers maintain in Mason County, a lot of folks are questioning whether or not it's time to go out on their own. They're looking at their own sets of data perhaps, or they're just looking outside and saying, I got to get outside. How are you working or talking with the community and saying, listen, I understand this could be frustrating for you, but we've got to do this, and things like that?
Jeff, I think the important thing to remember is the reason that Mr. Windom's able to move forward in the request for the variance is that we did a very good job from the beginning of trying to follow the directions of our healthcare providers and our advice on that. And we've done a pretty good job on that. And that's why we're able to ask for this variance. And I think staying within the guidelines and listening to our local health professionals, our local physicians, and our health department things on these guidelines, that's what's going to carry us through. I think that we've got to be cautious. We don't want to end up like I've seen a few places now that are having to go back and reclose things. We've done really well in Mason County following the guidelines. We've been able to go for this variance, Dave has, because we've done a pretty darn good job, and that's why we're where we're at. So I guess my request would be to listen to our health professionals, our health department in our community, try to follow those guidelines, be respectful of what is going on right now, and we'll move forward. But I think as Dave takes this to the state, and we might get that to start moving forward a little bit quicker, we still need to be mindful of the social distancing and all those safety measures, health safety measures that we've been asked to adhere to.
And Dave, talk to me about your understanding of how the flow between the phases would be. So if we move from phase 1 to phase 2, or from phase 2 to phase 3, and then it looks as though infections are on the rise, how quickly would we go back to the previous phase, and what would that look like?
So they're not talking about going back to a previous phase, and that's part of the plan. Is, do we have the ability to bring in, let's call them strike teams, that could jump on a particular outbreak or a particular cluster and pause where we're at in the phases until we get that addressed. And I think that's a really smart and quick way to not lose ground and keep things rolling, at least at a pause. And then when that is completed and concluded, and we feel pretty good about it, then we can move forward again. And
a lot of this too is to help to not overpopulate, I guess, the hospitals, like Mason Health, for example. The slowdown, the flattening of the curves and things like that were so the hospitals across the country could regather the PPEs they needed, make sure their staffs are healthy and at the staffing levels they need. That's kind of why we've been doing all this. Is that right? So we can build up these stockpiles so we're not just all inundated with a massive amount of infections and people going to the hospitals all at the same time, but by flattening the curve, this kind of spreads it out maybe longer, but not as impactful right at the beginning?
Yeah, I think that's a very accurate view. We're just trying to keep the hospital system from getting overwhelmed at the very beginning. And we were very successful at keeping that from happening. I mean, the folks in Mason County did a great job of doing what they needed to do. And the hospital was never in danger of being overwhelmed. And we had plenty of capability even beyond that. We had an alternative care facility that we could set up with 100 beds. We worked on a 70-bed quarantine isolation down at Building 10 if that became necessary. So we had contingency plans in place that we never had to touch, and that tells me the community did a great job of getting behind this.
Dave Windom, Mason County Sheriff Casey Salisbury here for the Sheriff's Sit Down. We held it off a day because more information was starting to come in. Wanted to make sure it was as accurate as possible. But I know you guys have got even more meetings throughout the day today, so we'll let you get off to those. Thank you so much for taking some time. Good information. And when we get closer either to submitting our ideas to go to phase 2 or when you have details, let's get you back on and we'll talk about it.
Thank you, Jeff.
Good to talk with you guys.